Did you know that a spicy wrinkled root has been used for centuries to calm the stomach and awaken circulation? Ginger does not look like sophisticated medicine, but its history crosses kitchens, ships, traditional pharmacies, and family remedies worldwide. For generations, healers, grandparents, and traditional practitioners used ginger for nausea, slow digestion, mild colds, and inner coldness. Its intense flavor is not random, because ginger contains natural compounds that create heat, aroma, and a unique digestive action. In traditional Chinese medicine, ginger is considered a warming root used to move energy, warm the body, and ease digestive discomfort. In Ayurvedic medicine from India, ginger has been used to support digestion, circulation, and the balance of digestive fire. In many Latin American homes, ginger tea with lemon and honey is almost required when cough, chills, or discomfort appear. The interesting part is that ginger does not belong only to tradition, because it has also been studied for nausea relief. Its best known modern use is connected with pregnancy, nausea, motion sickness, post-surgical nausea, and common digestive discomfort. Ginger does not work like a magic pill, but it may influence the stomach, intestines, and nerve signals related to nausea. That is why many people feel relief when drinking ginger tea before travel, after heavy meals, or during morning stomach discomfort. The part used is the rhizome, an underground structure similar to a root, where aroma, flavor, and active compounds concentrate. When you cut fresh ginger, its strong smell comes from natural oils and spicy substances released from broken plant fibers. Among its most studied compounds are gingerols and shawgols, which help explain much of its flavor and possible digestive effects. Gingerols are more abundant in fresh ginger, while shawgols increase when ginger is dried, heated, or processed. That is why dried ginger tea can feel stronger, warmer, and spicier than a fresh slice in warm water. One reason ginger became famous is its traditional ability to help when the stomach feels unsettled or uncomfortable. Many people use it before long trips, because movement from cars, airplanes, or boats can disturb balance and trigger nausea. It is also used after large meals, especially when there is fullness, gas, slow digestion, or upper abdominal heaviness. Ginger may help stimulate normal digestive movement, allowing the stomach to process food with greater comfort. That is why some cultures add it to soups, stews, and warm drinks, not only for flavor, but digestion. In Japan, it accompanies certain dishes. In India, it appears in curries and teas. In the Caribbean, it becomes intense drinks. Each culture adapted ginger to its climate, diet, and tradition, but almost all recognize something similar. Ginger wakes the body. When someone feels cold, congested, or tired, a hot cup of ginger may produce mild sweating and warmth. That effect does not mean it cures infections, but it can make some people feel more comfortable during mild colds. Ginger can also be combined with honey, which soothes the throat, and lemon, which adds acidic flavor and dietary vitamin C. However, it is important not to turn a traditional drink into an exaggerated medical promise. Because ginger does not replace necessary treatment. Ginger can support healthy habits, but it should not be used to ignore high fever, severe pain, persistent vomiting, or breathing difficulty. A useful natural remedy should know when to help at home, and when to leave space for professional medical evaluation. One of ginger's most popular uses is during pregnancy, especially for mild morning nausea in some women. Even so, during pregnancy, it is always better to ask first, because every case has different risks, medicines, and medical needs. Some research suggests benefits for pregnancy-related nausea, but not every woman should use concentrated supplements without medical guidance. Using a little ginger as food is very different from taking strong capsules every day. The dose, form, and person's condition completely change the safety of any natural remedy. Fresh ginger can be prepared, sliced, grated, crushed, or gently boiled to make an aromatic and spicy infusion. Many commercial ginger ales contain very little real ginger, and some have too much sugar to be considered healthy remedies. That is why, when seeking traditional benefits, it is usually better to check ingredients and choose simple preparations. Powdered ginger is practical, but its taste can be stronger and more concentrated than a small fresh slice. In cooking, ginger can be added to soups, smoothies, oatmeal, sautéed vegetables, fish, chicken, rice, infusions, and homemade desserts. The key is using it as part of a balanced diet, not as an excuse to neglect food, sleep, or hydration. Ginger is also used externally in some traditions, especially in warm compresses for tense muscles or localized cold sensations, but it should be used carefully on the skin because it can irritate, burn, or cause reactions in sensitive people. Ginger essential oil should never be applied directly to the skin without proper dilution and reliable guidance. Essential oils are much more concentrated than the whole plant, and they can cause strong irritation when used incorrectly. Ginger seems friendly because it lives in the kitchen, but in concentrated form, it can behave like a powerful product. Its most common side effects may include heartburn, stomach burning, gas, diarrhea, mouth irritation, or excessive warmth. If someone has strong reflux, active gastritis, or ulcers, ginger may worsen the burning sensation. It can also feel uncomfortable for people highly sensitive to spicy foods, especially when taken concentrated, dried, or on an empty stomach. That is why it is better to start with small amounts, observe the body's response, and avoid unnecessary high doses. Ginger can also interact with medicines, especially when used as a concentrated supplement and not just an occasional seasoning. Special caution is needed with blood thinners, antiplatelet drugs, blood pressure medicines, diabetes treatments, and some heart medications. If someone takes warfarin, daily aspirin, clopidogrel insulin, or strong medicines, they should ask before using ginger supplements. This does not mean all ginger is dangerous, but safety depends on each person's medical context. An occasional tea is not the same as taking concentrated capsules several times daily for weeks or months. People may also need to stop or ask before surgery because herbal supplements can affect bleeding, anesthesia, or recovery. The idea is not to fear ginger, but to respect it as a useful plant with real effects. A natural remedy becomes smarter when we understand its benefits, its limits, and its warning signs. For example, mild nausea after eating may improve with rest, hydration, and a gentle ginger infusion. But repeated vomiting, blood, intense pain, dehydration, or rapid weight loss need medical attention, not only home remedies. The same applies to abdominal pain. Ginger may help gas, but it cannot diagnose appendicitis, gallstones, or infections. In health, the most dangerous mistake is not using plants, but using them to hide symptoms needing evaluation. Ginger has also been studied for possible effects on inflammation, muscle pain, and mild joint discomfort. Some people use it after exercise or during seasons of joint pain, seeking natural support for inflammation. However, the evidence for pain and inflammation is not as clear as its popular use for nausea. It can be part of an anti-inflammatory lifestyle, alongside movement, sleep, healthy weight, and plant-rich eating. But it should not replace indicated treatments for arthritis, injuries, autoimmune diseases, or persistent pain without medical evaluation. An interesting way to understand ginger is to see it as support, not as the main character. The real main character should always be the whole picture. Nutrition, hydration, rest, movement, correct diagnosis, and professional follow-up. In daily cooking, ginger may help reduce excess salt, sugar, or heavy sauces because its flavor is intense. A little fresh ginger can transform a simple soup into a warmer, more aromatic, and more digestive meal. It can also make a drink more enjoyable without requiring too much sugar, especially when combined with lemon or cinnamon. For people trying to improve habits, that detail can be useful because flavor helps sustain healthy changes. Ginger also has an interesting place in cold drinks, such as infused waters, gentle lemonades, or fruit smoothies. Although traditionally linked with warmth, it can also be used in refreshing recipes without losing its spicy personality. In some homes, Ginger is stored frozen and grated directly over foods, preventing waste and preserving aroma. Another option is slicing it thinly, drying it slowly, and saving it for quick infusions during several weeks. The important thing is avoiding mold, excessive moisture, or soft roots, because natural remedies also require hygiene and good storage. Fresh ginger should feel firm, smell pleasant, and have fairly smooth skin without strange stains or slimy areas. When a root smells sour, feels too soft, or has visible mold, it is better to discard it. To prepare tea, there is no need to overcomplicate things, because a simple recipe can be enough. You can use 1 cup of hot water, a few small slices of fresh ginger, and 5 to 10 minutes. The longer it steeps, the stronger the flavor becomes, and the burning sensation may increase in sensitive people. To soften it, honey can be added after the water cools slightly from boiling temperature. Adding honey to boiling water is not ideal when trying to better preserve its flavor and delicate qualities. Lemon can be added at the end, because its fresh aroma combines well with ginger's earthy, spicy intensity. For a digestive version, some people combine ginger with mint, but those with reflux should observe their tolerance. For a warmer version, ginger can be combined with cinnamon, although cinnamon also requires moderation with frequent use. For irritated throat, a gentle mix of ginger, honey, and lemon may feel comforting, especially in warm drinks. But if there is high fever, chest pain, trouble breathing, or prolonged symptoms, medical attention should not be delayed. A practical rule is to use ginger for mild, temporary, familial discomforts, not for serious or mysterious symptoms. It is also important to remember that supplements do not always have the same quality, concentration, or purity across brands. Some products may contain unexpected doses, additional herbal blends, or ingredients that not everyone tolerates well. That is why capsule users should choose reliable brands and review labels, warnings, certifications, and amount per serving. Even so, for many people, the safest form is using ginger as food within a normal diet. Traditional cooking is often more moderate than modern supplements because it uses small amounts inside real meals. The problem appears when someone believes that if a little helps, a lot must help more. With medicinal plants, more can mean more side effects, more interactions, and more unnecessary risk. Ginger also has cultural value because it connects health, cooking, and family memory in one everyday experience. A cup of ginger does not only deliver active compounds, it may also provide pause, warmth, hydration, and care. Sometimes, that combination of ritual, rest, and flavor explains part of the comfort people feel. Traditional medicine did not always separate food remedy and ritual because it saw health as a complete experience. Today, we can learn from that vision while also adding evidence, safety, and critical thinking. Ginger deserves respect precisely because it combines ancient tradition with modern research, especially in the area of nausea. It is not a universal cure, it does not work for everything, and it should not be sold as miraculous. But, when used moderately, it can be one of the world's most practical, accessible, and versatile natural remedies. Its strength is found in daily life, a cheap route, easy to find, easy to prepare, and deeply culinary. If you have never used it, start slowly, because its spiciness can surprise even in small amounts. Try a gentle infusion first, and observe your digestion, reflux, tolerance, and any uncomfortable reaction. If it agrees with you, ginger can be included in meals, soups, teas, or drinks without becoming mandatory. If you take medications or have medical conditions, ask before using concentrated ginger supplements. This recommendation is especially important if you have bleeding problems, diabetes, low blood pressure, heart disease, or scheduled surgery. It also applies during pregnancy, breastfeeding, cancer treatment, liver disease, or any condition requiring professional medical control. The best natural remedy is not the strongest one, but the one used with intelligence, moderation, and respect for the body. Ginger reminds us that many traditional solutions were born by observing daily life, cooking, and the body's responses. It also reminds us that a useful plant can have real benefits, real limits, and real risks at the same time. So, when you see ginger at the market, Do not look at it only as another spice. Look at it as a root with centuries of history, used to warm, calm, flavor, and support digestion. A root that traveled through Asia, the Middle East, Europe, Africa, and the Americas, entering recipes, remedies, and popular drinks. A root that many people still use because it is simple, accessible, and easy to combine with healthy habits. And although science is still studying many of its effects, its place in global tradition is already well earned. The real power of ginger is not promising miracles, but offering simple support for common discomforts in everyday moments. As with many natural remedies, the key is knowing when to use it, how much to use, and when to seek help. Because caring for health does not mean choosing between tradition and science, but learning to use both responsibly. Ginger may be a small tool, but used well, it can belong to a more conscious and balanced life. And the next time you prepare a hot cup, remember that this humble root has a much larger story than it seems. Thanks for watching World Wellness Health and Nutrition.